Perfect. So hi, everyone. The following presentation focuses on a part of my postdoctoral work at Women's College Hospital. I too would like to start by acknowledging all the traditional territories on which we gather for this call. Today, I'm actually joining you from Kitchener-Waterloo on the Haldimand Tract, land that was promised to the Haudenosaunee of the Six Nations of the Grand River, and are within the territory of the Neutral, Anishinaabe, and the Haudenosaunee peoples. I have no conflict of interest to declare. So there are about 35,122 people living with HIV in Ontario as of 2019, and women account for 20% of these cases. Epidemiologically, little has really changed for women living with HIV in Ontario over the past decade, despite awarenesses of their unique health and social needs, as well as lived realities. Lower engagement and retention among women living with HIV across the care cascade compared to men has resulted in a large round of discussions on the need for tailored approaches to care. So findings from the national CHIWOS study have informed the creation of a women-centered HIV care model, which acknowledges the complexities of care for all women living with HIV. So from 2018 to 2020, the women-centered HIV care team worked with the Center of Effective Practice, utilizing implementation science methods to develop two comprehensive toolkits, one for care providers and one for women living with HIV. And to facilitate the operationalization of the women-centered HIV care model, the next step really involves training target audiences on how to use the toolkit and how to apply it to the practices of clinicians or health professionals, as well as community-based workers. So Dr. Senji Aurora, a hepatologist at the University of New Mexico in Albuquerque, developed the ECHO model in 2003 that we used. At the time, New Mexico had the highest per capita rate of viral hepatitis and really required a new model of healthcare delivery to combat this. So Project ECHOs really aimed to expand the capacity of primary healthcare providers to provide best practice care for common, complex, or chronic diseases, as well as to monitor their outcomes. And this method uses video conferencing to host weekly interprofessional rounds that connect practitioners who will present patient cases or questions to an academic panel of specialists who then provide guidance to enable the practitioners on how to treat their patients themselves. And Project ECHO has since expanded to treat other chronic complex diseases, such as chronic pain and headache. You have asthma, mental health, substance use disorders, diabetes, rheumatoid arthritis, as well as COVID, and this is seen globally. The primary objectives of the project we're working on is to disseminate the women-centered HIV care model across the province and to facilitate its uptake and change in practice, as well as to evaluate self-efficacy, satisfaction, knowledge, and change in practice across the target audiences involved in the project itself. So there are three expected outcomes in the dissemination of the women-centered HIV care model using this particular method. It's to strengthen capacity in both knowledge and resources related to the clinical management of women living with HIV, as well as to assist in identifying and managing the clinical domains of women-centered HIV care. And lastly, to connect expertise across a diverse group of health professionals to facilitate women-centered HIV care. So far in this first cycle, there are 21 healthcare professionals, as well as 9 community-based workers involved in HIV care that are currently participating in the ECHO project we've put together. Participants identified the city or town that they were currently working in and providing HIV care. And as you can see, most of the participants enrolled in this first cycle, 33% of them, are practicing in Toronto. So in terms of our recruitment strategy, there was an initial email, including the following recruitment flyers seen on the slide here, that was distributed through existing listservs, for instance, through CHIWOS, as well as the Ontario HIV Treatment Network to promote the series itself. We also reached out to the HIV Outpatient Clinic Network, the Ontario chapter of the Canadian Association of Nurses in AIDS Care, and family medicine residency programs, as well as infectious disease fellowship programs in Ontario, to assist in the recruitment of participants for the first cycle of this. In terms of participant inclusion and exclusion criteria, For healthcare professionals, they must be certified practicing physicians or specialists, nurses, nurse practitioners, social workers or pharmacists in HIV patient care and practicing in Ontario. For community-based workers, they must provide services to people living with HIV as part of their central mandate, as well be based in Ontario and have direct interaction with clients. Participants were ineligible if they did not meet all of these inclusionary criteria. In terms of study design, each healthcare professional and community-based worker is taking part in 15 live 1-hour interactive sessions led by clinical experts as well as community presenters, followed by real case presentations covering a range of topics within the women-centered HIV care model. There's also a range of different evaluations taking part over the 8-month duration of the project. First, there was a baseline survey that's looking to collect demographic and practice characteristics from our participants. We're as well collecting information around participants' objectives for taking part in the series itself and whether we're seeing practice change after having taken part in the sessions. We're also evaluating self-efficacy and satisfaction with the model and the sessions that have been put together. And a post-secondary questionnaire will be released to provide feedback on the overall ECHO project experience. We're looking to also facilitate focus group discussions at the very end of this, focused on really assessing the toolkit's function, structure, and content. And this would also be an opportunity for those participating to give us some additional opinions about the project and perhaps some concerns as well. In terms of data analysis, we'll be using thematic analysis to identify, analyze, and interpret patterns of meaning using Navivo software. For quantitative data analysis, that'll occur with SPSS software. We'll be taking descriptive statistical analyses to create summaries of frequencies, means, and standard deviations for each questionnaire. I've had an opportunity to start looking at some of the baseline data that was collected. There's a great deal more to look at, but I wanted to share some findings with you. These findings are reflective of some participants who answered the question, what was your motivation for participating in ECHO Ontario Women-Centered HIV Care? It's great to see the responses come in, of course. One being, I'm a healthcare provider, attempting to treat many women with HIV, and I wish to make my practice sensitive, informed, and comprehensive to their needs. Another question within the baseline that we pose to our participants are, what are your main objectives or goals in joining ECHO Ontario Women-Centered HIV Care? This is just a sampling of some of the responses we received. For instance, I want to ensure that I am providing care to our patients in the best way and to be equipped with the tools to empower our patients who are women, as well as I would like to learn concrete strategies for improving programs which center on women living with HIV. This kind of gives you a sense of our timeline for this. So for instance, the ethics submission and approval was made in September of 2001. We also received in the same month accreditation approval from the University of Toronto, continuing professional development. The launch, happily, was made on October 1st of last year. As I had mentioned, we're planning to facilitate focus group discussions in July or August of this year in order to gather that additional information. The evaluations at this time are ongoing as the sessions proceed. And we're hoping for data analysis and paper writing to take place from September to November of this year. Some of the questions or challenges we're experiencing in this study and would really like your feedback on include, how can we reach a more diverse target audience of health professionals and community-based workers in the second cycle of this? And what are some additional methods we can use to increase survey response rates? Currently, we're using QR codes, reminder emails sent through RedCap, and also some verbal kind of confirmation at the end of these sessions that we're looking for feedback to be collected, and the use of gift cards as well to help facilitate some of this increase. In terms of our research impact, why is this work important? We're hoping it certainly will lead to important information to inform the design of a large-scale intervention study across the country. And what does this work mean for the HIV community? It aims to support healthcare professionals and community-based workers in providing women-centered HIV care. So some concluding remarks I'd like to make is that we believe the ECHO Ontario Women-Centered HIV Care series has the potential to raise awareness of women's health priorities in the province. Facilitating this first cycle in Ontario will really help to enable a broader understanding of the need for and interest in a women-centered HIV care model in the province, as well as help to facilitate discussions around the next steps for a large-scale rollout in the country. And I'd like to thank Dr. Mona Lutfi for her guidance and support throughout my postdoctoral work at Women's College Hospital, as well as all of the team members involved in this particular study. Thank you.